Jocelyn, is this your first time seeing NextGen 8 or have you been working in the environment already? Jocelyn, are you able to hear me okay? No worries. Okay, perfect. Is this the first time you've seen NextGen 8 or have you worked in the environment already? First time. Okay. Well, it may just be us today. We did training last week. These are the last three kind of last call training. So I'll give folks one more minute and we'll go ahead and get started. All right, we'll go ahead and get started. Jocelyn, if you have any questions while I'm going through this, like I said, it may just be us today. Please feel free to unmute yourself and ask any questions, or you can type them into the chat if you'd like me to, show you any specific features or there's specific information you'd like to see. All right, so logging into NextGen is going to be exactly the same. So you have your app launcher. You're going to have an icon on your desktop that says NextGen 8 on it. And when you log in, of course, we'll take you to your screen. Go ahead and close this patient. You will still see your top toolbar here at the top. Three important features and in the top that need to be added to this top toolbar is the procedures, images, and documents. So if you don't see those on your desktop when you log in for the first time, you can click this down arrow up here on the right-hand side. Click the next one, and then we're going to go to customize. And then you will be able to find images, procedures, and documents over here on the left-hand side. And you can highlight that and just move it over to the right. And once you do that, it will appear up here on your top toolbar. And then you can highlight it and move it from left to right, or place it wherever those three you'd like to have. Hi, Juliana. We're just getting started. Right, so we just went over the fact that we want to make sure that procedures, images, and documents are in your top toolbar the first time you log in. So if you haven't logged into NextGen 8 already, the day that we go live, we want to make sure that we're seeing those. We have those set as your practice default, but for if some reason you don't see those, you can add them by clicking this down arrow up here in the top right-hand corner. Go to customize, and then you can select those icons from your left side navigation, add them to the right, and then you can move them up and down. And up and down is left and right across your toolbar here. Another option is to click the reset button. And if you reset, it will reset your current settings to the practice default, and you will see all three of those icons. All of your preferences in your current environment will carry forward. So you'll have your default practice or default location, your default provider, as well as any smart phrases or quick loads, preferred templates. All of those will carry forward. So you won't have to recreate all of those again. Searching for a patient, still the same. You're going to click on your patient icon here. And then you still have the same functionality to search for your patients. Double click to launch that patient. And as soon as the patient's chart launches, will be the first time, if you haven't been in NextGen 8, that you'll notice a significant difference in how NextGen is laid out. So of course, your first screen that's going to pop up is any patient alerts. And you will be able to see your EHR alerts on this tab, as well as any PM alerts, and you can toggle between the two. You still have your add edit functionality, your snooze functionality, acknowledge, remove, and close. So we're going to go ahead and acknowledge. And we're going to start up here in the top left-hand side. In the new environment, the patient information bar is now called the patient information card. And the reason is they've created a file maintenance system practice file that will allow you to customize this toolbar and the patient information card with anything that you'd like to see in these 4 sections, as well as any of the hyperlinks here at the bottom. You have a down arrow in the top left-hand side that will allow you to minimize your card. If you'd like to have more area here where your templates launch. Your patient's image will carry forward, and you have the hyperlink with hover over functionality over the patient's name. If the patient has a preferred name listed on the PM side, it will appear there as along with birth, sex, current gender, the patient's primary insurance, and their contact information. If you click on the hyperlink, it will launch your demographics on the PM side. And you'll see if I want to add a preferred name, I can add that here and click OK. And you'll now see that patient's preferred name here at the top. You also have the patient's date of birth along with years, their birth sex, and their MRN. All of these have hover over so you can see what each one of those fields are. Next to the MRN, you have an ellipsis or a hamburger button called Profile Options. If you click on that, you can start a new encounter. You can create a new task. You can modify the patient information, which is just exactly what we just did. And you also have a new feature called Add Patient to My List for tracking. The next icon is your patient portal icon. And with the same functionality as in your current environment, an X next to the patient's image is the patient is not enrolled, an exclamation point is pending enrollment, and a green checkbox identifies the fact the patient is enrolled in the patient portal. If the patient's portal enrollment is complete, you will see this enroll now change to patient message. That will take you to your inbox to send a patient portal message. You still have your alerts here at the top with hover over. And if you click the button, it will launch your alerts to make edits or view, as well as a new button here for new encounters. You'll notice all the buttons that used to live here at the top, your medications, vaccines, appointments, allergies, those have all been moved over here to the left-hand side, and we'll get to those in just one moment. On the far right-hand side, you have a new feature called Selected Encounter, and this is a visual indicator of what encounter you have selected in the encounter history. And again, you have your patient demographic information, as well as additional hyperlinks here. Over to the left-hand side, you'll notice that the buttons that used to launch your patient tracking, your telephone communication, to do or new task, and your external applications, those buttons have been removed. So to launch a telephone communication template, you're going to use the hyperlink here on the far left-hand side. To start a new task, you can choose that from the hamburger button here to new task. And your patient tracking we'll get to in just one moment. As we move down into the encounter history, you'll notice a double arrow on the left-hand side. If you click that, it will minimize your patient history to give you more space here in your templates launch. You have your encounters and your categories. And you'll notice, compared to your current environment, demographics has been removed. To access the demographics tab, you'll find that in open encounters. If you click there, you'll see a demographics tab, and you can click that from here. So next to encounters, you have categories, and this is your scanned or generated documents that are in the chart. And when you click that, you'll see your document categories as well as the number of documents that are scanned into those categories. You have a search feature that will allow you to search for documents by a keyword. Your refresh, and a cog icon for your encounter preferences. We are going to go over that now. All right. So I'm going to flip back over to encounters here. You'll see I have my encounter history showing in the window. I'm going to go ahead and click on the cog. And here are your preferences for how the encounter information appears in your window. So what's appearing on your screen now is your practice default. So this is how it should appear for everyone when they log in. However, if you have security rights to make changes, you can do so from this window. So right now we have the default view to show the encounters. You can also set it to start in categories. So if you're working in medical records and you want to go to categories first, you can. When a document launches, we want it to launch in EHR, but you also have an option to have it launch in document management. Again, for your medical records staff or your HIM staff, that may be helpful for them. In the My Patient History settings, we have the options to show the date, the time, and the provider. And you can change the layout of how the date, the time, and the provider is shown in the window. We want to view it by encounter date. You can also view it by billable date. So for billers, folks like that. We also want the location, remarks, and encounter number to appear in that window as well. In this section, you'll see the current order that you have these options set. If you'd like to change that order, you can click on the button here and click and drag, and you can change the order. And if you don't want to see remarks or the encounter number or location, you can certainly uncheck it. You'll see it will be removed from the list. And once the encounter is started and a specialty and visit type has been chosen, we also wanted to show the specialty and visit type as well as the diagnoses. And this next section is your show or hide template links. And these are the blue hyperlinks that show the templates from within the encounter. And our default option is to show all items. You also have an option to just show the most recent, which will show the last 5 that you've opened. You can hide all of them or only show for unlocked encounters. Your encounter history filters, we want it by billable encounters, and this is your practice default. The very bottom section, you have a new option for categories called My Categories, and we'll come back to that when we switch over to the categories preferences. Right, so I did make some changes here just so you can see the changes once I apply them. And you'll see I took off remarks. So up here at the top, I have the date, the time, the provider and location, the specialty, the office visit or visit type, and the encounter number, as well as the diagnoses codes. I go back to this and I apply my changes. So I take off remarks. I'm going to move the encounter number up here in front of the time. I'm going to click apply. Now when I open this up, I can actually drag this over a little bit so you can see it as well. I now have the date and time. Now the encounter number is showing in the first position, provider location. And if I expand it, I have the encounter number, the family practice specialty, and the office visit, as well as the diagnoses. If by chance you have made changes and you want to switch it back to your practice default, you have an option down here at the bottom called Reset to Practice Settings. So I'm going to go ahead and click that. You'll see all of my settings reapplied. I can click Apply, and you'll see that that now has moved the encounter number back to the end. Switch over here to categories. And currently I have my view set as tree view. I want to switch that. There's one other option called list view. And if I click that, It removes your categories and lists all of your documents in one big giant list. You also have some new filter options for searching for documents. If I hit the down arrow here, the current default is to see all documents, but you can also choose to only see documents for the last 30 days, 60 days, 90, or you can set your preferred preference. If I only want to see documents that are associated with the location that I have chosen up here at the top, I can select this option. If I only want to see documents that are associated with the provider I have selected up here at the top, a specific date range, I can also filter by all, specific providers, specific locations, any specialties that the patient is seen in, as well as if they're associated with any programs for behavioral health. I can save this as my default view, or I can go back and click all so that I can see all documents. I'll click apply. Switch my view back to tree view. The new feature in NextGen 8 is my categories. So you can set up specific categories that you want to see quickly without filtering or having to make any selections. So for example, if I'm a biller and I want to have my category set up to automatically filter out to show the master IMs, I can do that. And that happens up here in the cog, the top right-hand side. I click on that, go all the way down to the bottom to my categories. And if you hit the arrow here, it will pop up your predefined category, document categories that are set in file maintenance. And you can select what categories you want specifically in to make it a little bit easier for you to view. So I'm going to select a couple just to add them. I'm going to add referrals. Go with diagnostic labs. Click apply, and that will add those categories to my list. And keep in mind, the same functionality as in your current environment. If the patient does not have documents scanned into that category, you will not see the category. So it will only appear if there's documents scanned in. So now I have a quick filter for the things that I want to see and a quick at a glance. And I can also switch back to all. And I will now see all documents. From within the documents, if you hover over the very end here, you have another ellipsis called document options. If you click that, you can see your provider sign-off details, your patient portal history, as well as recategorize if you need to recategorize a document. Switch back over to encounters. And we're going to move down this left-hand side. And again, these are the buttons that used to live at the very top, or they were icons on the far right-hand side of your current environment. So our first icon here is our allergies. We can hover over and see any active allergies the patient has. We can also click on it and launch the medications allergies template. The next one is your problem. So any diagnoses that's been linked to the patient as problem or chronic will show here. So you can have the hover over functionality as well as a count of how many problems are linked to the patient. And in the hover over, you will also see any of the codes that are linked to your HCC. And if I click the icon, it will launch the problems module, and it will just default to the problems list tab. The next icon is your medications. Again, you have hover over functionality that will show the patient's active medications, along with a count of the number of active medications. And if you click on the icon, launch the medications module. The next icon is your immunizations, and it will show any pending or past due immunizations when you hover over. If you click the syringe, it will launch your orders module defaulted to the immunizations tab. The next icon here is your appointments. And if you hover over, you will see appointments past and future. And you can customize how many appointments you'd like to see from the past or future. And we'll look at that when we get down to the settings for your quick buttons. Next one is your vitals. You hover over, it will show your vitals grid. And if you click the icon, it will show your vitals history. Give your grid here at the top, as well as any orthostatic vital signs. The next icon is the icon that replaced your beakers or your test tubes in your current environment for your orders. So now it is a test tube and a bone. And if I hover over, it will show me my orders. And if I launch it or click on it, it will launch your orders module and it will default to your order summary. The next icon is the beaker, and this is your lab results. This one does not have hover over functionality, so if you click on it, it will launch your results grid for quick access to patient lab results. Next one is care guidelines, and hover over functionality will show any due care guidelines. You also are able to click to trigger the care guidelines full template in the paged view. The next icon is data share. And this functionality allows you to retrieve records from outside sources, including medications, as long as you're connected to the NextGen Share Care Quality. If you launch this, it has a new layout and design. We are in a test environment, so will throw an error if you click on it in your test environment because we're not connected to the interface. The first tab here at the top shows you any searches that you've done for medical records and anything that you may have exported and reconciled into the patient's chart. The next tab is search, and this is where you would complete any searches for records external. And you can define where you want to search and the date range you want to search those documents, as well as if you want to import or search for scanned or filed PDF documents. If a search is in progress, you'll see it in this window here. So if you're doing a search and you want to go do something else and come back and check, that in progress will live here. And when the search is complete, it will move over to the right-hand side. The next tab is export, and this allows you to access the medical summary utility from within EHR. In your current environment, you have to use a utility that you launch separately. And this functionality will allow you to send referrals, send documents via CCD to a hospital. The tabs over to the right, if you're connected to your public health department, you can send public health case reports using this tool. The open CCD files are any files associated with this patient. If you have an error or you're trying to figure out why something's not working, you have your logs here that you can check. The next button is the on-demand CCD. You have refresh as well as any custom viewing functionality. Your next icon over here to the left are any diagnoses codes that have been associated with the patient. And this one also has a counter showing 166 diagnosis codes. If you hover over, you'll see your diagnosis list with your HCCs identified. And if you click on it, it will also launch your problems module, but this time it will default to the billing ICD list versus the problem list. Your next icon is your sticky notes. And the visual indicator that there's sticky notes attached to this patient. If there are no notes, the post-it icon here is blank. If something has been typed into sticky notes, you'll see the visual indicator will now appear with lines. And if I take the documentation out, again, it will switch back to a blank sticky note. At the very bottom, you have a cog that will allow you to set preferences for these buttons here on the left-hand side. You can change the order. You can also remove buttons that you may not want to see. And you also have a cog setting here for your appointments. And if you click on that, it will allow you to set a preference for how many past or future appointments show in your hover over for appointments. If you make changes to this list and you want to reset to the practice preference settings, you can click here and it will reset. You can simply hit apply. Again, at the very top, you have the double chevron, double arrow. You can minimize your patient history for more space here. You're working in the templates. So we are going to start a new encounter. And in most cases, your encounters for patients who are here for appointments are started at the front desk. So those would already be here. But for our training, for training purposes, I'm going to go ahead and create the encounter. There are 3 places that you can create a new encounter from actually there's 4, where you can create a new encounter. Do new encounter from the ellipsis here. You can click the button called new encounter, or you can click new. And for today, I'm going to use this button and I'm going to create an encounter for today. And you'll see it populate into the left-hand patient encounter history. And now the new encounter button has changed and has changed to patient tracking. And that was previously your compass that lived over here on the left-hand side, where you can set your patient room as well as the patient status. Save, close. And this has hover over functionality where you can hover over it and see that information. Okay. So we now have a brand new encounter created. If I expand that, you'll see our preferences here with the provider location and encounter number. The double arrows here on the right allow me to expand that information. It will pull in your patient's current active problems for at a glance and their medications. It will also set up categories for documents, templates, and modules. So as we're going through the chart, it will put those templates in or documents or modules in the right category. You also have, if you hover over the right here, you have a new ellipsis, and this will replace your right click functionality. So if you're right clicking on an encounter to lock it or unlock it or set sensitivity settings, you no longer can right click on the encounter. You have to click the ellipsis called encounter options. And this is where you will see your sensitivity settings, lock, and if you have security rights to do these things, delete encounter, your encounter level insurance, remarks, as well as properties. To open a template, we're going to click the Open Template hyperlink here at the top. And you'll see a very familiar window pop up called Select a Template. So if you have preferred templates selected in your current environment, those will stay the same in the new environment. You also have the functionality to select all to see all templates. And again, this is where you'll find your demographics templates. So if you're opening orders administration or patient demographics on the EHR side, you can do that from here. So we're going to start on the home page. Just going to move this back over a bit. Choose my office visit. So my specialty was selected based on the provider settings if they're linked to this specialty. So it's defaulted to family practice. And I chose the visit type as office visit. Move this back over a bit. And you'll notice that all of your tabs and all of your hyperlinks or sub-navigation links are all the same. They're exactly as they are in your current environment. You still have your risk levels up here at the top that you can launch and set your risk level for your patient. Your care team. So if you're adding a care team member to the patient, as well as being able to choose if you want to include that care team information on the master document or the patient plan. Your contagion risk. As well as your HCC management. To the right, you have your risk configuration. So if a patient is identified as a smoker, the TOB for tobacco will automatically default to the yes icon, which is a red exclamation point or a white exclamation point in a red circle. And the disease states are added by clicking the cog here. And this will allow you to give a visual indicator for hypertension, diabetes, or CAD if the patient is currently diagnosed with one of the three or all of the three. And we will uncheck one just so you can see the indicator change. And again, your smoking status will automatically pull over from your social history. Once I click Save and Close, you now have visual indicators of the disease states the patient currently has been diagnosed with: tobacco, hypertension, and diabetes. The CAD I removed, so now you see the universal no symbol with this circle with a line through it. And again, all of your tabs are the same. All of your sub navigation is the same, as well as your care guidelines with the count of care guidelines that are due. And you can launch your care guidelines paged view, same functionality, your disease states listed down the side, same functionality in your care guidelines. You have your care guidelines refresh button. So if you want to refresh your care guidelines, you can do that from within the template or outside the template. If you're using global days, you still have that access, as well as your panel controls. So panel controls, of course, is if you hit the down button, it will expand all your panels. The up button compresses all your panels. And your cycle will start at the top. And as I click the button, it will cycle through each panel that I have listed, bring it to the top of the screen till I get back to the beginning. so that I don't have to scroll. Take it right back to medical chart. And you still have the ability to click, hold, and drag to change the order in which your panels are listed on the screen. And then you have the indicators still on your panels. For folks doing chart prep, you still have the full functionality of your medical charts to view any HPIs, plans, all of the things listed here, as well as all of the other panels are the same as well. We're going to flip over to intake. So up here in the general panel, you still have your established or new, your historian, as well as your interpreter details and the configurable questionnaires. These have been separated in NextGen 8. So you have your interpreter details, so they can be customized to with questions that are required or not required, as well as set up custom configured questionnaires. And you would see that in this category view up here, you guys have a COVID screening that would allow you to do a quick screening for a patient. And these can be built and customized as needed. You still have your buttons for family planning and transition to care, as well as your family or pregnancy prevention, your family planning, yes or no, during your visits. Down in your reason for visit section, you have new functionality called the HPI history. And if you click this button, it will launch a new box that will allow you to select a previous HPI. So if I want to, patients coming back in again for their anti-coag, you can add this to the grid. Down here at the bottom, we have copy HPI and close. And you'll see that that will carry forward into my grid. And then if I want to make any changes to this, I can click on it and come in and make any changes to my notes. And you'll see a visual indicator that tells you that this was copied forward, and you have access to your my phrases and save and close. And you'll see that data will change in the HPI. You also have two new HPIs. One is called STI screening, and this is a gender neutral STI screening. So that if you have a patient that is female and in the back we realize they're male, you can launch the STI screening and it will provide the questions for both genders. And you also have a new HIV PEP and PrEP HPI for folks that are being managed or starting on prophylactic preventative HIV medications. You still have the manage down here at the bottom. So you can clear out HPIs that you entered if you don't need them to be on there, as well as your full list of all the other HPIs that are available. History summary is exactly the same, so no changes there. Same as your vital signs. That information is all the same. Go ahead and I'm going to add a weight and blood or weight, height, and weight here. You'll see that the patient is being identified as being overweight. And you have the ability to add a BMI plan at this time. So you can click BMI plan. You guys have a OSA solution that will automatically pull the plan into the health promotion plan. And if the clinical staff are approved to add this, you can click add. If not, it will be highlighted in purple on the SOAP note so the provider can click add after they've reviewed it. So for this example, I'm just going to click OK. You'll see the HPI plan change to purple so that you know that there's a plan there. I'm going to go ahead and save and close. And you will also see that the health promotion plan will turn purple out on the outside of the template, as well as your visual indicators in the panel. Medication reconciliation, exactly the same. You still have the ability to do a electronic reconciliation, as well as manual. So if you do electronic reconciliations, you can still use the button here in the top right hand side. You're manually reconciling the medications. You can add who you did it with a source. You can choose who you confirmed it with. Again, same functionality. If you select review taken as directed, you can move them all down to the bottom here. If you need to make an edit here, you can select and change the adherence, update it. You'll see it update there. Patient is transitioning into care. You can select the box at this time and click OK. Again, you'll notice your medication reconciliation button will automatically select. For allergies, you'll see your common allergies pop up. If we choose manage allergies, your medication allergies will display. Again, same functionality to be able to add an allergy. Choose acetaminophen. And for this patient, it's just an intolerance. So we can choose now that it's an intolerance versus a full allergy. If they are allergic and it's been confirmed, you can select this, as well as the severity and reaction. Severe allergy, we can add. Locality. Okay. And it will populate here. Yeah. And any notes you'd like to document about it. Okay. Update, and then it will look at any medications and the patient's current medications and let you know if there's any potential interactions or contraindications. And to get through there, you need to acknowledge that. You still have full access to your orders from intake. And we'll go over review of systems on the SOAP note. And here at the bottom, you can access your PHQ2. If you are doing the PHQ9, it will automatically launch it with a +2. Add any comments, and save and close. And the scores will populate here with the interpretation and change the hyperlink color to purple. This time you can still generate your intake note. Intake note will add the details of everything you went over during the intake. And if I click this double arrow now, just as an example, you'll see any documents that I've generated are now here in the documents section. Templates that I opened are in the template section, and any modules I opened are here in the module section. I have the completed orders that have been added. So I did my PHQ2 and 9. Jump over to SOAP. In SOAP, again, you have the new functionality with the HPI history, and we demonstrated that in intake where you can carry forward your history of present illness. The history summary is exactly the same, so no changes there. Your review of systems, you now have a review of systems history. This is new functionality for NextGen 8. If I click there, I'm able to carry forward a review of systems, and it will automatically default to the past 2 years and the current provider that I have selected up here in my top toolbar. And I can remove that provider by clearing, or if I hit the arrow, it will show me any of the providers that the patient has seen. I can do a search and it will pull in any review systems. I can copy it and it will automatically pull that review of systems into the review of systems panel. And I can still click on each system and make edits as needed. I still have my full functionality over here on the left to open a brand new one-page exam. Or again, any of those systems that I want to edit. You'll notice a visual indicator here that the findings were copied forward from the date and for this provider. And if I were to edit something in the template, it will add a visual indicator that it was copied forward, but it was edited. Your vital signs, it's same functionality, and we did add the health promotion plan for the BMI. If the provider is required to click the add to add it to the patient's plan, they'll see that it's purple, and they can simply click the add button after they've reviewed, and it will add it to today's plan. Okay. In the physical exam, you now have a physical exam history. And same functionality as with the HPIs and the review assistants. I can carry it forward, copy the physical exam, and it will carry that information into the grid. Still have my one page, my full exam templates. I can simply click on anything I need to edit. All of your hyperlinks are still functioning as they are in your current environment. And you can save and close. Get that visual indicator here at the bottom that the findings were copied forward by what provider and on what the date that it was copied from. And in your assessment and plan, you'll now see the BMI plan has been added, as well as the PHQ 2 and 9 that we completed. And we still have our functionality for the DXAP history. And in the new environment, you can copy more than one. I think I have both of these already added. So carried that forward. And then we can choose to copy the plan and close, and it will add it to the patient's plan for today. Still have all of my hyperlinks here, same functionality as in your current environment, as well as your IMO. Scroll down to the very bottom. All of our buttons for consents, procedure scheduling, follow-up. Your add update's going to take you to your assessments. Still have all of our functionality available up at the top. And our advanced beneficiary notice. If you're doing narrative notes or dictation, it will filter into this section called narrative notes. If you're using ambient assist, those can copy forward. You have access to your my phrases as well. And you can also copy dictation forward from any previous notes. will copy into the appropriate field. And then you can save and close. These templates are no fun. At the very bottom, you still have the buttons to its dictation, E&M coding, to generate a document, to generate the patient plan, to get to procedures. These are predefined procedures, launch the medication module, and then your provider communication. Right. So to go to the Finalize tab, I can scroll back up to the top and click on Finalize, but I can also hit this E&M coding, and it's going to take us over to Finalize. The functionality on Finalize is still the same as in your current environment, with one addition, which is this E&M, if I scroll down, called Medical Decision-Making Elements. If I had documented in the patient's chart for their visit, it would automatically start to add these items to the list, but because I didn't, I'm just going to manually enter, and you'll see that it's starting to add these here, and it will give a calculated level of service. And this is to assist the provider in their final coding so that they are coding correctly. In the evaluation and management panel, you can still make adjustments to this code that's automatically filled here. You can select from down here in your predefined. And then once completed, I will submit my codes, and it will generate my master and submit my charges. Still get the visual indicator on your Finalize that your charges were submitted. The master will generate. And as we discussed earlier, when we were talking about these icons here at the top, you no longer can get to the procedures template from the right-hand side. To get to procedures, you're going to click on the medicine bag and syringe here at the top, and you can see the codes that were submitted for today's encounter. And if I click my encounter history, you'll now see my intake and my master are the documents that have been generated, all the templates that I accessed, as well as any modules. Your visual indicator that the master IM is unsigned is still a blue flag or a blue checkbox if it's been signed off on. You now see the full assessment and plan, any completed orders, medications, and active problems. If I go to my PAQ, I will see my master IM there to be signed off on. And new functionality in the PAQ is you now have the ability to right click on a item and mark it as unread. So it will rebold it as a reminder to come back if you weren't able to finish it. You also have the functionality now here in Add View for comments to use my phrases. So if I want to add a my phrase before I as a note to task to my clinical staff. If you want to create my phrases for the PAQ, you cannot create them from the PAQ. You have to do it from another template that has the manage my phrases functionality. So I will close out of here really quickly. We'll go back to the SOAP template. Just going to use the assessment and plan panel. So any place that has my phrases actually on the template, for example, here, I can click that. I can choose my phrase type as PAQ. And that's what we're going to call the phrase type. Create the my phrase. Now you'll see it listed here. And if I go back to my PAQ, my phrases, you'll see that my phrase that I just created. Add that. Save. We'll add it to the note. So if these were labs and I needed to sign off and send this to my nurse to or my clinical support staff to do something with it based on what my notes were here, I can click sign off with actions and click task. And if you have a standard group of folks that you're tasking things to, you can save these as defaults. But for this one, I am just going to task it to myself. So I'm not going to add a recipient here. I'm just going to hit run actions. It's going to sign off on the document. I'll take it out of my PAQ. Look here now, I'll see a blue checkbox next to the master IM. And for the clinical staff or whoever was routed this message to, populate where it should, to their inbox with the notes down here to call the patient with results, normal, no follow-up. I can add additional comments here if I'd like, but I can also launch the patient's chart, add a telephone communication to reach out to the patient, and complete the task. And then it will move out of my inbox. All right, so we did go a couple minutes over, and I want to answer any questions that you may have. So if you have any, please feel free to unmute yourself and ask or type them into the chat. I'm happy to go over anything or re-review anything you'd like to see. All right. Well, if there's no questions, thank you for your time today, and we look forward to our go live next week. Please don't hesitate to reach out with any questions or concerns. Otherwise, I will talk to everyone soon.